Perfect schools don't exist.
Then pick your poison by yourself.
Hello, my beautiful listeners. Welcome to the first ever episode of Scrubs and Stories. I am your host, Samira Owase, and today is going to be a very exciting episode. I am joined with me two of the most amazing friendships I've made in med school. These are the first two people I met when I moved to this town, and since then, I'm super grateful that we've had to go through this med school with them. I'll let them introduce themselves. Maybe we can start with your names, which faculty you're in, where you're from, and maybe just a little bit about yourselves.
Okay, my name is Faith. I'm in the Faculty of Medicine. I'm in the 6th year, and I don't know what else to say.
Yeah. Maybe also where you're from.
Oh, I'm from Zimbabwe.
Okay. Yeah.
I'm Kudzaishe. I am in the final year of the dentistry program, and I'm also from Zimbabwe.
Okay.
Yeah.
How are you guys feeling? Are you excited to be on the first guest on the first episode?
Yes,
nervous.
actually, yeah. Nervous, but
bit
like
nervous,
it's really
but
it's really nice that you invited us.
Thank you guys
Thank
for
you for having
coming.
us.
I'm so happy that I had to do this with you, and you guys are the first people that are on here. So this means so much to me.
Thank you for having us.
So much.
Okay, without taking so much time, maybe we can get into how we got here. How did we get to Poland, guys? How did we end up in med school? How did we end up in dentistry? Maybe you guys can take us through what your journey has been like. What inspired you to pursue this career, dentistry or medicine? Maybe you can start with you, Faye.
Okay, well, I didn't know what degree I wanted to do until until I got to a point where it was a bit ridiculous that I didn't know what I wanted to do. Like everyone was doing applications, I was like, I don't know, guys. And
Yeah.
everyone knew I was doing like maths, biology, and chemistry, and they kept saying, "Oh, so you're gonna be a doctor?" No, I always refused.
So in high school, you did biology and chemistry.
Yeah.
You didn't know you wanted to do.
No, I
do
didn't know I
medicine.
wanted to do
Okay.
medicine.
Wow.
Yeah, and then someone said to me, maybe you should ask your parents,
Mm-hmm.
like what you should go for. And I asked my dad. He said, "Nah, I'm not telling you."
Oh wow.
He said, pick your poison by yourself. I'm not involved. And then I asked my mom, and she said, well, you could go for medicine. And I said,
Mm.
And that's what I went for in the end. So my mom told me.
Wow, that's very unique because usually, as African parents, they already know what they want their kids to do.
Yeah.
They're like, yeah, you're gonna be a lawyer, you're gonna be a doctor.
Yeah.
But it's really nice that your parents wanted you to choose this for yourself. They just kind of gave you an idea of what they think.
Yeah. My dad really said, nobody chose for me, so choose on your own.
Wow.
I said,
Wow, Kuzi, how has that been for you?
I went for dentistry because I think I really liked my dentist. I got braces when I was like really young, like 11, and I had braces for 7 years. And I think I just looked up to him and like what he did and how he changed my smile, made me feel more confident. And I wanted to do that for other people. But also the money's good, I mean.
Yeah.
Let's be real. The
Wow.
money's good.
Did you know the money was good before you went into dentistry, or?
Everyone thinks doctors make
Yeah.
so much money until you get there and you realize, oh, it's not as much as you think it's going
Yes,
to be.
That's true.
But I think it's also very like a stable career. And apart from like me actually wanting to help people and the more fun part of it,
Yeah.
I think it's very stable. The hours are good. And through remuneration is quite good. So like you can't really think about passion all the time. Sometimes you need to think the bills to be paid.
Yeah.
And
Yeah.
you have to look at all these things. And I just thought it was a very good place to end, like a good middle ground
Yeah.
for all these things. Yeah.
That's true. I know for all of us, we kind of have an idea of what medicine or what dentistry is.
Yeah.
But for someone out there who has no idea, okay, what is dentistry? How long does it take to study dentistry? And is it very different from medicine? You know, like what career path they could take if they were thinking they had the same inspiration as you, for example. What would you tell that person? How would you describe dentistry to that person?
So it's a 5-year program in most countries. Some countries it's 6, but I'll talk about Poland because that's what I know.
Yeah.
It's a 5-year program. The first 2 years are very similar to medicine. So you're studying anatomy, histology, pharmacology, all these other programs not programs, but courses that everyone in the MD program is also doing. And then where it becomes more interesting, in my opinion, is the 4th and the 5th year, because it gets very clinical. So like now I go to the clinic every day, I treat patients every day, and it feels like you're at work, but you're still at school. And I think it's very satisfying. There's a art kind of it. Like when you're a dentist, you're sort of an artist because you're using your hands, you're helping people get better smiles, you're changing the way people look. But there's also the healthcare side to it. You know, you need to know how the body works, how what you're doing affects the rest of the body, and all these things. So I think it's a nice mix of the art and the science. And there are a few options. I mean, of course, once you study dentistry, I think it's so niche. Your options after are so limited.
Yes.
So everything revolves around the teeth. You know, you can maybe focus on the gums, or you can focus on being an aesthetic doctor or a surgeon, but everything, your career path is sort of very limited to the mouth. If you compare, for example, if you're a doctor, you can become a neurosurgeon or an orthopedic surgeon. There's so much more to do. But once, as a dentist, you specialize from the get-go, and there's nowhere else to go. So you kind of need to be sure it's what you like, because there's not a lot of places to go from there.
I actually, you mentioned something about being limited. I know for medicine, for example, once we finish the first 6 years, you have like so many specialties you can go into. For dentistry, do you also have like specialties you could get into, or once you finish dentistry, it's done, you can start working and you can just you can stop from there and you don't need to go any further if you want? And if there are any specialties, what would those specialties be, maybe, for example?
So you can be a general dentist, right? Where you're basically doing everything: root canals, aesthetic dentistry, a bit of surgery. And then you can specialize to, I think there are about 7 specialties in total. So the first one is an oral surgeon. You can become an endodontist. And what they do is they perform root canals mostly. And then a I don't know how to say this.
Periodontist.
Thank you, periodontist. Yes, a periodontist. And what they do is they just focus on the gums, the oral mucosa, and how that interacts with the rest of your teeth and the rest of the mouth. You can go into oral medicine, which again also focuses on systemic health and how that interacts with the rest of the body. What else can you do? You can become a maxillofacial surgeon, but in most countries you need to do a medical degree as well. And then you can go be a maxillofacial surgeon. And when you do that, then you can treat cancer patients, and you're performing surgery of the head and neck. Basically, you're doing everything, a bit of plastic surgery. So that I think is the coolest sort of specialty there is. Yes.
So that would make 6 years of medicine, 5 years of dentistry,
Yes.
and then specializing again.
7 health specialty.
Oh my goodness.
And that's what I want to do. So I've got the long way ahead.
Wow. Wait, for that one, you have to first do medicine, and then dentistry. So for
And
you,
then specialize in maxillofacial surgery.
that's crazy.
That is
So
crazy.
if that's what you want to do now, you already did dentistry. Now, are you saying you're going to do
med school.
medicine? Okay.
Of course, right now that's what I want to think. That's what I think I want to do. But once I start working and I make money and I see how sweet that is, I don't know if I'm going to want
Going back to
to
school.
continue and go back to school. But that is at least the plan, to then go to med school 4 years. Because there are like graduate programs that allow you to go for 4 years, and then 7 to be a maxillofacial surgeon.
Wow.
It's a long way to go, but I think it's interesting.
I'm sure you get a lot of money after that. You're literally the boss of the hospital.
Money.
It's not about money. Is it not?
Yeah.
Oh, well, thank you so much. I think we kind of have like an idea of what dentistry is. Faye, could you also take us to medicine? What is medicine, and what does that look like for someone who doesn't have no has no idea what medicine or what the journey of into medicine looks like. How many years does it take? Pretty much in your own words, describe what the medical journey looks like.
Okay. So again, in Poland, a degree in medicine is 6 years. You start off with pre-clinicals and then you go into clinical classes. So the first, and it depends what uni you go to, which I chose this uni kind of by mistake. I don't know. The first 2 years is like pre-clinicals, so like your theory, your anatomy, physiology, biochemistry, and then you go into pathophysiology. So you learn about how the body works and then what could go wrong, right, in second year. And then in third year at our university, then you start clinical. So you start to do rotations. You get to start to meet patients. You get to learn to examine them. A patient walks into your office. What are you going to do? You know, how do you talk to them? What do you need to check on them to make sure that everything is okay or to see if there's a problem? And that's what you start from third year, along with pharmacology, the drugs that you can give to them. And then there's just like the main subjects in medicine, which you like sixth year, like medicine all boils down to sixth year, which is your surgery, pediatrics, psychiatry, emergency medicine, family medicine, and internal medicine. So it all boils down to these subjects, and you will pretty much be doing these and gynecology, sorry. You'll pretty much be doing these subjects from third year on repeat until sixth year, and then you write your final exams. And for me, that's pretty much medicine. It all boils down to a summary of everything.
I've noticed a lot of people don't know what, like, you mentioned that we take 6 years into medicine, and then, like, for example, back home they ask me, okay, after you're done, are you ready, like, to be a doctor? Is it done? Can you treat this and this? Or a lot of people ask you, okay, what specialty are you doing? What are you specializing in? They don't know that it's a whole different,
it's a whole process.
It's a whole different process. Once you finish the first 6 years of medicine, you also have to go ahead and specialize if you want to specialize in those major subjects you talked about. Could you also, like, kind of highlight what that looks like? The process, okay, medicine in 6 years, and then what's next?
What comes next?
What's next?
So again, it depends what country you go to. Some countries you go in straight into specializing. You choose which path you want to take. So if you want to go into psychiatry, you just go straight into that. In Poland, for example, the UK where I'm going, you would do internship. And again, how long internship is depends on where you choose to go. So it could be 6 months, it could be 2 years. And in this internship, a lot of people say it's just like the final year of university. You're like a baby doctor. You are seeing patients. It's just that you're getting paid now. And then the reason it's like that is because actually after graduation, a lot of us are not ready to be completely responsible for people's lives on our own. You have been under supervision this whole time. You've not prescribed anyone any medication. Someone asks you, oh, I have this problem. What can I do about it? You say, I think you should this and this. I think you should soak your toes in some water, but maybe you should go see a doctor. Like, we are not 100% sure, and so we still need help. And so you go for internship, and you complete this internship, which is supposed to be a bridge between med school and practicing as a doctor on your own. And then you would apply to some kind of specialty, whether it's GP training or family medicine, or it's something more, sophisticated, like neurosurgery.
I have no idea. I'm going to act like I have no idea what this thing is, the whole thing of medicine. So I'm going to ask from a perspective of someone who has no idea what that is. So you said that, okay, so once you guys are graduating, you're in your final years, do you need to do specialty? Is it a requirement for you? Or do you only do it if you want to?
Okay, well, I guess it depends what your goals are in life. Some people are going to go, for example, for GP training or for family medicine, which is basically the same thing, just depends what country you're in. That's like your general practitioner, your general doctor, first contact doctor. the one that knows you from when you were 2 months old until you were 59, you know, the one who said, okay, I see you have an ear infection, maybe you should go to an ENT specialist.
Yeah.
But they will redirect you to where you need to go so you can get further help. But they will also try to help you themselves.
Is it?
Why should you specialize?
Yeah. What's the point of
necessary.
specializing? You know why I asked this question?
Yeah.
Because you can also help if you want. Why I asked this question is because, okay, for me, I'm from Rwanda, and I've noticed that a lot of the process to get into residency in Rwanda, it's easy. It's not as hard as like here in Europe, where you have to go through this whole process. So I was wondering why we don't have that many specialists or people that finish med school and then get into specialties. So I remember I once asked this one doctor, I'm like, why is it that not so many doctors go to specialize if the process is easier? And they're like, some of them just get comfortable just being a general doctor.
Yeah.
And others, some like, it's never about the money. You guys get more money when you're specialists. They're like, it's never about the money. Sometimes the whole process of becoming a resident itself is
It's
scary.
actually very stressful.
So yeah, that's why I asked you guys, what do you think on that? Do you feel like it's a necessity or it's a need for you personally?
Okay. So the thing with specializing is that it's like you take a more specific approach to medicine. You are specifically interested in hands and the bones that work in the hands. So you're gonna go and be an orthopedic surgeon who specializes in hands, right? Maybe you're actually not even interested in how the stomach works. You just want to focus on hands. So you're gonna go down that path. And I think that's the good thing about medicine, like Kudzi was saying, there's so many different pathways that you can take.
Yeah.
Right. So it's just about picking like your niche space that you are interested in yourself and going for that. And it's not like you have to. So like I was explaining GP training or family medicine, you could go for that and you could finish a lot earlier. Or you could maybe have a calling for something more specific and you could go and specialize. Yeah.
Kudzi, do you think a lot of people, when they finish dentistry, after 5 years, they get into specialties or they just stay as dentists, general dentists?
I think it's a mix. Like I see it with my classmates right now. So I think about half want to stay as general practitioners. To them, it's good enough. I want to be a dentist. And okay, I just want to clarify by saying specializing doesn't make you any more special. And like deciding to be a general dentist or a general practitioner is not a cop-out. But what I'm saying is, to them, once they become general dentists, to them, they have met the goals and the aims they want to achieve. And for them, that is good enough. And they're okay with going to patients, doing a little bit of everything. I know I've been talking to some of my friends, and they say they want to be general dentists because you have a little bit of everything. So it doesn't get boring and monotonous. And whereas if you become a specialist, if I'm going to focus on doing surgery all the time, one, I'm going to get the hardest surgical cases there are, that all the general countries, so they're referring to me.
Yeah.
And two, you're doing the same thing every day. So, you might get a bit burnt out or you might end up hating it. So I think, like you said in the question, it depends on what your goals are.
Yeah.
For some people, if you enjoy the broader picture, then being a general dentist or a general doctor is a very good way to go. But for some people, you have something that interests you, something very specific that you find interesting, medicine and dentistry. And for those people, I would say, go on and specialize and focus on what you like, because then it's a long career. You're going to be a dentist or a doctor for 40 years. And if you're going to be doing something you don't like for 40 years, that sounds very miserable.
Yeah.
And I think if specializing and focusing on something specific helps you be happier with what you do and enjoy your work a bit more, then by all means, we need to find a way to do that. So at least that's how I see it.
Yeah. That's a very interesting way to put it. I think it makes a lot of sense because a lot of people feel the pressure to immediately get into specialty, but you actually have to sit down and and
This is what you want to do.
exactly. Yeah, I feel like we've gotten deep into things. Maybe we can go back and actually talk about how we ended up here in this why did we choose Poland in the first place, or this university? And what was your process like coming to Poland and applying to this university? You can take us through that.
Okay, so specifically applying to this university, it was 2019. I had to come here for an entrance exam. I was in Europe for 3 days. I wrote my exam, I went back home, and just like crossed my fingers and hope for the best.
That time it was in person.
Yeah,
Oh.
because
We
this
were
was
lucky because
yeah, you guys got lucky.
Oh.
Yeah.
Is it back to is it
It's
now?
online now.
It's
It's
online.
still
Okay.
online.
Okay, that's
Yeah.
good.
I think they have more diversity now since they made
Yeah.
it online.
Yeah.
Yeah. But it's like I had decided on medicine. I had a friend who was applying to WUJ, and I had thought like, okay, well, I'm just gonna apply and see what happens. And then my dad said, okay, but like what other universities are in Poland? And
So for you to think of Poland, it was
because somebody else was applying.
okay.
One of my friends was applying. So I said, okay,
Okay.
me too.
Yeah.
Me too, that's what. And then I saw, I saw Jagiellonian.
Yeah.
And so I started looking into it more. My dad asked me, okay, so what's up with Jagiellonian? Oh, well, the exam is in person, so I guess that's a bust. And he said, why is it a bust? And I said,
Oh wow.
what? And if I fail, he said, you're just not going to fail. It's that
Yeah.
simple. So they sent me here, I wrote the exam, and I went back home, and I passed it, which I would not recommend my method of studying to anybody because they gave us like a topic list. I looked at that topic list. I looked at the topic list for like the Cambridge A-level syllabus, and I said, this is what matches up, so that's what I'm gonna read. If God wants me to go to that school, I'll go to the school.
You literally didn't care.
Nah,
like, whatever
I
happens.
shouldn't have been
happens.
taking such a chance, but I did.
Yeah.
I said, if God wants me at that school, I'll go to the school, and I'm
Yeah.
here right now.
So
So
you're saying your friend went to WUJ. Why did you apply to WUJ? What made you think of this university?
I applied to WUJ.
Yeah.
I applied to Krakow. I applied to Debrecen in Hungary as well.
Okay.
But when I mentioned WUJ to my dad, he said, okay, yeah, cool, fair and fine, apply to WUJ, but what's better in Poland?
Yeah.
What's higher ranked? Or what's the highest ranked? And that's how Krakow came up.
Okay, true.
Yeah.
But in this whole process, you never thought of staying in Zim and
I
doing-
did. Oh,
and
shame.
doing medicine in Zim?
Oh, I applied to Zim.
Okay.
They didn't even respond to my application.
Me too.
My grades were not good enough to stay in Zimbabwe.
Oh my
No.
God, why? Oh, is it about the grades?
Yeah.
Sorry.
It's like you had to have
Okay.
3 A's. I had 3 B's.
Mm.
So
Me
like
too.
yeah. So even when I tried to like hand in my application form, they said, "Babe, you got 3 B's. Like apply for something else." I said, "I want to apply for medicine." They said, "Apply for pharmacy." I said, "I want medicine." I'm sure they threw my application out like as soon as I left or something.
So
I
you have
didn't
to
even-
have all A's. You have to be the
Yeah.
smartest kids.
Yeah, I didn't even get a
Okay.
response on my application. And actually, none of my other applications worked out, just this one, which was very ironic because it was the hardest application to do.
Yeah.
So I trust that I was just supposed to be here. Yeah.
You were just meant to be here. What about you, Kudzi?
I didn't want to be in Poland. I wanted to go to the US,
Okay.
go to biomedical engineering as pre-med, and then go into dentistry later.
Yeah.
I applied to a couple of schools. I only got one offer back. But if anyone knows anything about America, the tuition is a bit ridiculous. So if you don't get like a full ride scholarship, you're not going anywhere. So I got accepted to one school. They gave me about 25,000 in scholarship per year for the 4 years. But the difference was almost 36,000. So
Wow.
my dad just said, you're not going
Yeah.
anywhere because we can't make that much money here.
Yeah.
So I had to look elsewhere. Then Poland happened. I applied to WUJ as well. I got in. It was the first one I got into. And then thank God for COVID, because if it wasn't for COVID, I wouldn't have applied to the school, because my parents would just said to me like straight up, you're not flying to Europe just to write an exam that you might fail. So it's not happening.
Yeah.
So COVID happened. They moved the exam online, and I wrote the exam. I passed the exam, and the rest is kind of history.
It's crazy
you know?
how all of us, we just chose this school as a by the way, or
Yeah.
it wasn't the first option on the
Yeah.
top. Okay, that's very interesting. How do you guys feel that you chose this school? Do you feel like you'd recommend anyone else to come to the school?
Is the
Because
dream
I had the same experience.
Sure.
Because I had the same experience. For me, I first did pre-med in Warsaw, and I was gonna stay there for medicine as well. But again, just like you said, I looked for the best universities, the ranking, the highest
Yeah.
ranking universities in Poland. And this university came up, and I was like, you know what? Let me just apply. It's just a test. So I applied, and I also got in, and that's how I got here. But yeah, so I want you guys to tell me what you do. You feel like that was the best choice you made back then? Is it the? Would you recommend this university?
I personally,
Or maybe should we move on to the next question?
No, we can go for it. We can go for it. I have nice things to say. Don't worry.
I personally recommend this university.
Mm-hmm.
Why? Because when you think about it, like I said,
Yeah.
you do 2 years of preclinicals and then you get into rotations,
Yeah.
right? I feel like I got to, and I've always said this, I feel like I got to start what I signed up for earlier than other people who I know.
Yes.
Because other universities in Poland, they start their clinical classes, they start rotations in 4th year. We start them earlier. And I can't lie, 1st and 2nd year was a wild time because how are you gonna bunch out like anatomy, physiology, histology, like all of it, and then give me, and then throw pharmacology and pathophysiology at me, and biochemistry and all of it in the first 2 years. You want to throw
The
that at me?
curriculum is really good. I'd
Yo,
say.
I was stressed, but the fact that I got to start clinical rotations in 3rd year, start to meet patients, it made me feel like I got to start what I signed up for earlier than other people did.
Yeah.
And I think it's worth it.
Yeah.
And for me, ending up here, sometimes I say it's dumb luck, but I really feel like God just accounted for my stupidity because
Yeah.
I didn't do as much research as I should have before.
Same.
Yeah, everything just worked out so perfectly in the end, and I said, okay, this
Yeah.
was a good choice.
And I also had cases where some students would say a lot of universities would take in students for the first year, and then they'll make it so hard for you to
Exactly.
move forward to a point. A lot of students will have to drop out.
Yeah, they have
Because
like
they can't get through.
they have like 400 students first year. 2nd year, you're 200.
Exactly. Yeah. But this one, I think they're very
They
lenient with us.
they help you stay. They don't want you to leave. They want you to get through your degree.
Yeah,
And
and I
I love
remember
that.
that's one of the first things you told me
Yes.
when I first came here.
They
like,
want
you know,
you to stay.
you stay. Don't worry.
Yeah.
You make it through. Don't worry.
And whether
And
it's
that's nice
about
to
them
know.
wanting your tuition or them just wanting to make sure
Yeah.
you reach your goal,
Yeah.
the point is they want you to stay. It's a common goal for the two of you, and it just works out for you in the end.
That's true.
Yeah.
Exactly.
Okay, can you tell us why you?
No, I think it's a good school. I think it's a good school. It's not gun to my head. I think it's a good school. I think perfect schools don't exist. I'll start by saying perfect schools don't exist, and this school is no exception to that rule. It is not perfect. There are so many things that could be done better by faculty, by the school office.
Yeah.
Forbid. There is so much more that sometimes you feel like they have to give us and that you don't get. But I think when it comes down to it, it is a good school. I would recommend it. Again, talking about dentistry, we start clinical classes in 3rd year. There are a lot of schools that don't do that. The number of patients we see a year in all these different cases, a lot of schools don't get that.
Yeah.
The clinical aspect, the theory, sure, but the clinical aspect of like the dentistry program is so rigorous and intense, and they are making you see every possible case, well, as many as you can. And I think that's what makes it a good program. When it comes down to the hands-on and practicing to be good doctors in the end, they really do a good job in that. Sometimes, you know, as far as like administrative things, there's always more to be desired, especially from the school office. But I think It's a good school. I would recommend it. I think the one thing I would say if anyone is thinking about coming here is you just need to be intrinsically motivated to get the best out of your medical education at our school. You know, you need to be willing to put in the work. You need to go above and beyond. You need to want it, because if you just do the bare minimum, you can do the bare minimum and just go by. But if you really want to become the best you can be, then you really need to personally be motivated to put in the work and to go out and take the extra mile. Because if you don't do that, I feel like sometimes it's very easy to not get you know, a very good outcome out of it.
Yeah,
you know?
that's true.
Yeah. But no, I have nice things to say.
I see what you mean. So this was a promo. Yeah, you might as well, you know.
This will obviously to sponsor
I'm
us.
sure you missed. Okay. I also want to ask you guys about, you are both from Zim, and I'm sure you're also required to have a visa to come to Europe, to Poland. How was that application process for you? Was it hard? Because I know now things are very different. How was it for you back then, applying to come here to Poland?
For me, it was quite straightforward. It was 2019, pre-COVID. Appointments were not difficult to get.
Yeah.
It was just really just you and your bank account.
Yeah. Okay. For someone who doesn't know, what they require, what is required of them to go through that visa process,
Yeah.
what would you advise them? I'll give you an example. For me, the application process, then it was much easier because all you needed to do was get your documents, maybe like a few documents, your diploma, your what's it called? The admission,
Acceptance to
the acceptance
university.
letter, the acceptance letter, and just other documents, notify them, and then take them to the embassy, and that's it. But now, for you in the first place to get an appointment to the embassy, it's almost impossible.
Really?
So yeah, it's almost impossible. They've made the system very hard to be able to come here to Poland. So how is it in Zim? How is the visa process in Zim? Is it easy?
Back then it was easy, but for me, it was during COVID. I didn't even have to go to South Africa because we don't have a Polish embassy in Zimbabwe. So you have to go to South Africa to do the process. But for us, it was during COVID, and the Polish consulate in the country just said, drop all the documents. So everyone's document, we paid a DHL fee. They sent everything to South Africa. They sent us back, and that was it. Like, the process was simple and straightforward. It sucked because at first, like, they didn't want to help, but they did help, and I was like 10 days late for school.
Yeah.
But the process was really simple. All they really cared about at the end of the day was the bank statement.
Okay.
Yeah.
Did you guys have to do any no interviews, nothing like that?
Nothing.
How long did how long was the process to get
The visa?
Yeah.
10 business days.
Wow, that's really nice.
Yeah.
Okay, but same as me. It was like 1 day or 2 days.
But I don't
wasn't
know
hard.
how it looks like now. I'm not sure now, but when we did it, well, I did it after you.
Yeah, because I'm
was
just
pretty
realizing
simple.
I had to do a lot more traveling there.
Literally, DHL did
I had to
everything.
go to South Africa.
No, I didn't have to.
Yes.
Yeah.
Okay, that's good to know. Okay, this was the first phase.
Yeah.
We were pretty much introducing ourselves and what we're doing, just to give you an idea of what dentistry and what medicine looks like. For this next phase, we're going to have a deck of cards, which we are going to answer these questions. These cards have questions on them, and each one of us will pick a card, and then we can discuss the question.
Okay.
Are you guys ready?
Yes.
Okay, who wants to go first?
You're the host. It's your house.
Okay, I'll go first.
Yeah.
By the way, none of us, even me, I wrote these questions down, but I haven't thought anything about the questions. So this is so random. We're just randomly thinking at the moment. So don't take it personally or anything like that. Okay. How has this med school life impacted your mental health? Whoa, we're starting strong.
Yeah, what's that?
Okay. Moment of silence. Because what? I feel like for me, it has been a roller coaster. So many emotions. I don't think they prepare us enough for how med school or going through this journey is going to impact you mentally, physically, emotionally, all of it. So no one told me I was going to have to, for example, in the hospitals or dealing with patients. Sometimes you'll go in the hospitals and you deal with a very hard case, and now you have to deal with it personally. No one trains you all of this. So all these are new emotions that you now have to learn how to, navigate all of it. So I wouldn't say that it's an easy ride to go through. It's hard mentally, and I would tell anyone that is considering this career that you have to be prepared emotionally and mentally that you're going to be challenged.
Yeah.
Yeah.
I would say I wasn't emotionally prepared, but med school taught me coping mechanisms.
Yeah.
It taught me to learn coping mechanisms. It taught me to, I always say this, like to figure out where your safe space is and to report to that safe space when things are looking a little crazy.
Yeah.
Yeah. I think that's what med school did to my mental health. It taught me that when things get crazy, because they will,
Yeah.
you need to know where to go.
How to deal with it.
Yeah.
Yeah. And what would you say your coping mechanism is?
It's a secret.
I mean, it's like when I first came to med school, it was food.
Yeah.
Right?
Yeah.
But then I met the gym.
Yeah. Okay.
Yeah,
You're
I
gym
met the
girly
gym,
now.
started
Muscle.
I learned the gym in
Yeah.
med school. I learned just like communicating with people who like identifying who in my life brings peace.
Yes.
And just like cozying up to them more and learning that they are happy to have me around and they are happy to be there for me and that I can come and cozy up to them when I need it.
Yeah.
Yeah.
That's beautiful.
I think as a foreign student, there are like two ways to look at it. There's the impact that the school has, but also you can't forget the impact that being here for school has, which is like completely not school related. So of course, school, you go through burnout a few times a year. Exam sessions are coming, you're burning out. So that's one part of it. But the other thing you need to consider is what comes with being a foreigner, what comes with being particularly a very different looking foreigner, and the emotional toll that has on you. I mean, I had to go there. It's like the emotional toll that has on you, and sometimes it's your patients, and you can see your patients are not happy with you because of it, and it's also just the depression that comes in winter because you haven't gone through winters like this in your life.
Yeah.
So I think when you talk about a
It's
medical
a lot.
journey, it's not just about the academic
Yeah.
part of it. There is the other side that comes with I'm doing academics in a foreign country.
Yeah.
And that on its own, in my opinion, has a greater toll on you than the school does. But that's not to undermine what school does because school wreck you.
Yeah, definitely.
Yeah.
Okay. Yeah, I think
Yeah.
that's done. Next card.
Okay, I'll do that. If you had the power to change one thing about the whole med school system, what would you fix and why?
The school office. It's personal.
explain.
I'm really sorry.
Okay.
The whole podcast when we talk about the school office is personal. It means something to me. It's personal. And if I had to change one thing, the school office. Just because, I don't know, maybe the medicine program is a bit different, but I think with dentistry, and a lot of people in dentistry complain about this, it just feels like they don't support us enough. You know, sometimes when we request for things to say, we think ABCD will make our life easier, will make will make the education better. It will make the learning environment better. And most of the time we're asking for things that, sure, they're not bare minimum, but they're not that much. And I feel like time and time again, we've constantly gotten those.
Yeah.
And at the end of the day, it feels like we pay a lot of money and we just keep getting the bare minimum, the bare minimum, the bare minimum. So for me, if I could fix one thing, I know it's a bit irrelevant to the question, but if I could fix one thing, it would be just to say, when you have an administrative system that is supporting you as well,
Yes.
it makes your life easier than when you constantly have to be fighting with them and fighting academics and so.
Especially because they're also international students.
Yeah.
I feel like there's a lot we pour into the school that we deserve that support in return. Yeah, I get it. Yeah. Faye, what about you?
Well, I don't know if this is maybe other mid schools have it, but I think it would be nice if we had some kind of way to review medical education, but like not for an exam and not for, not by subject, because obviously the different subjects have, the different subjects will come back. Like I've said, you're gonna have OB-GYN from third year until like sixth year, and so on and so on. But it would be nice to have a way to just learn medicine as a whole in just like one relaxed place. Not for an exam, not for whatever, but just to do it. Because I think if you had to learn hypertension for like quiz night on Wednesday night, you would know hypertension for a very long time after that. You know? Because we have very much a culture of just trying to learn things for the exam.
Yes, that's
and
true.
Then forget that and learn for the next exam and then the next one, and you don't remember what you learned for the first exam. Even though you got a 5. So I think it would be nice to learn in that way, to learn just to learn and retain knowledge, not to learn just to write exams.
I think for me, if it was to change anything, it would be to make it more practical than theory. Because I feel like at the end of med school, a lot of us don't know how to even act when we go to hospitals, because I think maybe the systems are different in different countries. But I know, for example, here, once you're done here, yes, there's a few things you'll be able to do, but there's a lot you wouldn't be able to do. For example, they'll take you to a hospital and ask you, okay, can you, for example, draw blood or, measure something, and then you have no idea. You only know the theory part of it, but not the practical part of it. So for me, if it was to change anything, it would be to make it more practical. Yeah.
My turn to pick a card?
Yeah.
Okay.
Where did you put yours?
And just
Okay.
but you can
Put it back.
Did you go through any culture shock? And what helped you feel like you belong?
I'll tell you something.
let me tell you something.
The beginning of first year. I made friends, right? We met at school, everything's fine. We said, let's go out. We went out. I saw them. God forbid, I tried to hug someone. You don't hug these Europeans.
Yeah,
You don't hug them.
that's true, actually.
Because they don't hug.
I've never seen
What, we've met one time and you're trying to hug me?
Really?
I've never seen people hug.
Where are your friends from?
No, I've never seen people hug.
You know what school is? I did this.
They look uncomfortable.
I've never been so embarrassed. No, they just didn't respond. They just looked at me like this. Never again. I won't. I don't hug people anymore. I stopped. But it made me feel better when I made African friends and I could hug them.
For me, I definitely did. But I think there's so many moments that I would not even remember them, like all of them right now. But I feel like just being a black Muslim woman itself, who is visibly like a hijabi, there's a lot that comes with that, especially the stairs. Like you're going.
I just realized you would have had it worse.
Oh God, the stairs. You're going to walk in the streets, and so many people are going to be staring at you. Sometimes I'm like, are you staring at me because I'm black or because I'm a hijabi? Sometimes you don't know what it's. Yeah, you know how delusional I am. Most of the times I just think, oh, okay, so you're pretty. Yeah, so I think it just comes with a lot of things, but to be honest, Poland, the way I expected it, or even not this university, but Poland itself, I expected it to be worse for me because I was scared. I was scared the first time I came here. I didn't see that many black people. So I was like, how is this going to be for me? So I was scared that I'll probably like, encounter so many racist moments. But so far I've only had like two, and I'm grateful that, it's been easy for me. And even in the hospitals, I was scared that, like when you're going to see patients, when patients are seeing you for the first time, maybe a patient is going to be like, no, I don't want her to touch me, but yeah, nothing like that. So I think it's been okay. Yeah, it has its downside, but I think it's been okay.
Yeah, I think I'll just add on to what you said. When I came here the first few months, I remember the first time I had a panic attack was in Costa.
No way.
Ever in my life. I just felt like everyone was looking at me. And, if you're not used to it, I just felt everyone was looking at me like everything was closing in. I don't remember what I had gone to, but I just went straight home. Because
Was that in your first month in Canada?
it was like my first or second month here. It was just too much for me. And like before I'd go, I was just, oh my God, I'm going to go back in the public and everyone's just going to keep looking at me.
Yeah.
Now I don't see it anymore because I'm so used to it. But it's one of those things that the staring, the first few months, it gets to you. And, you just need to like mentally prepare yourself for that. But also, I think just one really good thing about Poland, I think it gets a bad PR outside Poland where people are like, oh, it's going to be so racist and all these things.
Yeah.
And then you actually come here and it is not horrible.
People don't care about you, actually.
Yeah.
They just
Everyone's
look at
just
you.
giving their own life.
They just look at you because, maybe they've never seen a black person before,
Yeah.
which is what like a lot of my Polish friends have explained that like a lot of people have not seen black people before.
Yeah.
So they're looking at you because you're like, oh my God, who's that baddie? No, but it's just like, they're like, I've never seen you before, and it's something interesting and intriguing to them.
Yeah.
But it's not like there's no ill intention to it. And I think that's one good thing, or at least that I'd like to say, if you think about coming to Poland, be prepared for the staring, but it's not out of like ill intent.
Yeah.
Exactly.
Yeah.
People talk about racism here. As in here 6 years, and probably I've had like 4 racist encounters. So it's
One
not
each year?
that
I haven't had it.
At
No,
least,
one year.
one a year. The first one, like, I was in the mall, and someone just started screaming, "Go back to your country!"
No way.
You don't have anywhere to go, but go back to your house because you're so embarrassed. But it's not that horrible.
In the mall?
In the mall, yeah.
What did you do?
I was minding my own business, going to the mall to buy like food in the grocery store,
Yeah.
and then he just started screaming, "Go back to your country!" So at first I didn't know it was me. And then I looked around, of course I was the only black person. And I was like, go back to Africa. I was like, oh yeah, it's something to me. So I was like, okay, I'm gonna go home now. So,
Oh my God.
Yeah. But
I also had the same thing. I remember, okay, let me tell you a story. The first time, when I first came to Poland, I came to Poland in 2019. No, 2019.
You're Warsaw.
Yeah, I was in Warsaw. And the first 3 months, I was out every day because I was going to school. I did not see any black person in those 3 months. Any black person. And the first time I saw a black person, it was on a bus stop. I was so happy. I was so happy I couldn't stop myself. I went straight to them like, hi! Do you know what this person did? He just looked at me as if like I'm a crazy person and just walked away.
No, that would be so mean.
I was like,
It would be.
I was shocked. I was like, what?
Oh no.
Are you not as excited? Are you not living in the same country as me? I was so shocked. And then from then on, I was like, oh my God, this is going to be the worst experience, like just being here. But yeah, just like you said, it's never ill intent. They don't have ill intention. Yeah. When you approach them and you try maybe to like form a friendship, it'll be fine. But now it's But now I think it's very different. There's a lot of black people here. Yeah.
I just had one time, but by the time that someone in Poland shouted at me, "Go back to your country," I spoke Polish back then. And I said to her, okay, but look, it's 10 a.m. and you're drunk. Maybe you should go home.
Do you say it in Polish?
Yeah.
She was saying to you in Polish.
She was shouting at me. It was a group of us, like Zimbabwean girls, and she was shouting, "Go back to your country."
In Polish.
Yeah.
Oh.
And I said, okay, but look, it's 10 a.m. and you're drunk. Maybe you should go home.
What did they?
She didn't say anything after that.
She must
was
have been
just very
shocked.
surprised that I
Like, you
spoke
spoke
Polish
Polish.
back.
Yeah, it's like she's Polish.
Yeah.
Yeah, that's crazy.
Anyway, so the last round for this game, little game. It's my turn, right?
Yeah.
What differences have stood out to you between the healthcare system here and back home? Any surprises? I'll go first. I was actually surprised. Okay, a lot of people, when you're in Africa, a lot of people tell you how we have the worst healthcare system. But when you come here and you compare, you actually realize that we only lack resources, but otherwise we are good. I don't know how it is in Zim, but for example, let's start with the medical system. I have a cousin who's also going through medicine, and he's also almost in the same year as me. So we've been comparing our years as we go. And to be honest, he is way better than me compared to how, for example, they do more clinicals, they do more practicals than here. A student who is in a third year will know how to, for example, I remember there was a time we were in third year and I was asking him, so what are you guys doing in third year? How is it like? And it's like, oh, in the OB/GYN rotation now, and I just delivered a baby a few minutes ago. I'm like, what? Delivered a what?
Baby.
Delivered. And I'm like, okay, you delivered by yourself? He said, yeah, I did that by myself. So I feel like they get more exposure to the practical part of medicine more than we do, which I think is a big advantage, because at the end of the day, you're not going to go out there and, as much as you need the theoretical part of it, you also need the practical part of it. And you cannot compare yourself with someone who's been practicing for a long time. So you cannot compare yourself. So I think the system there is good. It's good. And that's one thing that surprised me, because I didn't think it would. I thought, from what I've heard from people from other places, I thought it would be the worst, but it's actually good. We just lack resources.
Yeah, I agree with that.
think?
I feel like here we learn a lot about the different diagnostic techniques because they're available.
Yeah.
And it's not that people back home don't know them, they know about them. But someone back home will diagnose their patient without the advanced techniques that are used here, because for them, they rely heavily on the clinical approach, not so much on the diagnostic method that you could possibly use. Something for me that really stood out when I did clerkship in Zimbabwe is that because here we have this language barrier, like I speak Polish, but not to the point of fully having a whole conversation with a patient in medical jargon and catching everything, right? And so it's like here we're taught in LTC is that like how to take a patient's history.
That's what LTC is. Sorry.
Lab training and clinical skills.
Perfect.
Yes. So that's the class where we learn how to deal with a patient when a patient walks into your office, right? We're taught how to take a patient's history and how to hear from the patient what's going on with them, so that you can come up with, like, at least be on the right direction of what could be wrong with them. And as much as we learn that, we don't get to do it so much in the hospital. We do it, but because the patient speaks Polish, you can't control that. You have a translator, maybe it's the doctor, maybe it's another student who speaks Polish and English, so they'll be translating for you. You lose a lot of information with that.
And that student who's translating for you will gain more knowledge.
Exactly. And I noticed that when I started to catch on to Polish, like, oh, but this wasn't said. Oh, but this the patient said this and this and this, but it wasn't said by the translator. In Zimbabwe, you are expected to come to the hospital 30 minutes before the bedside starts. You should, at any point that a doctor asks you to tell them about any patient you've spoken to, you should have one on standby. Someone to speak about. Because you should be doing that on your own, in your own time, at any given time.
Yeah.
They do it so thoroughly, they do it so well. And I only realized how important it is to learn to speak
have
to the
that
patient.
interaction. Yes, yes.
When I learned in Zimbabwe. Yeah.
But I think I agree. We're not really lagging in education.
Yes.
I think the education, in fact, I think we make up for the lack of resources by education. We almost overtrain the doctors. But again, like you're saying, it's the lack of equipment, it's the lack of the latest technologies and all these other things. So sometimes you look at someone's approach and they say, oh, there's so many better ways you could have done it that are like more cutting edge and, you know, better precision or whatever. But I think as far as the education goes, education is not lacking, but we just lack resources. We lack the latest technology and yeah.
Yeah, I think that's true. I actually realized the other day that in Cuba, the country, because of how they lack some resources, they have changed their education system to be able to cover all those, like, for example, if you don't have a CT available, they have like ways to tell if a patient has a stroke, or they have gone ahead and built it in the education system where it's very different. They teach you more symptoms of what a patient could have for you to be able to immediately try to diagnose what the patient has.
Compensate for the lack of resources.
Compensate for the lack of resources, which I think is really, really nice.
Yeah.
Yeah.
We can move.
Okay.
Move on to the next question.
What's the biggest misconception you've heard about med students that makes you roll your eyes?
There's so many. Oh my God.
Yes. But here's my thing. When I tell people, oh, I went out this weekend, they're like, you weren't reading? Hey, am I supposed to kill myself?
Yeah.
No, we don't have to just do books and do nothing else. We actually are able to have lives. And it's actually really important to prioritize fun and living. Because life is for the living, guys.
Yeah.
That's my
I
misconception.
think all we do is read.
Yeah,
You know?
they think that we don't do anything else. We're just... Yeah.
Yeah, that's true. That's one. I think a lot of people also think medical students, oh, when you say I'm a medical student, like, yo, you're smart.
Listen.
I don't know anything.
Listen.
No.
I don't think for you to be a medical student, you have to be smart. You just have to be willing to work hard.
Yeah.
I think that's different.
Yeah.
So we are not all the smartest people you're going to meet around here. Some of us are really dumb. We're just surviving.
Yeah, there's some really dumb med students.
How did you get here? Did you write the same exam?
Exactly. So
yeah.
Things for me, it's less of a misconception. But there's this idea, I want to look into the camera the next one. There's this idea that dentists are not doctors. And I just want to say, I get it. But I don't get it. Because for the first 2 years of dentistry, we're basically doing medicine. I have courses in pregnancy, internal medicine. We do all these things. And I think if you're willing to call someone with a PhD a doctor, but the dentist not a doctor, then I just like priorities. And also, you know, I read somewhere where they said, if you think a dentist is not a doctor, just wait for the day you're in pain. And then you most likely go to a clinic and you don't say, dentist, I'm in pain. You're going to be like, doctor, I'm in pain. So, yes.
or when you go to a GP and they're referring to yeah, I can't do this.
Dentists are doctors, not doctors are dentists. Dentists are doctors, not doctors are
I
dentists.
didn't say... What? I didn't
Say
say doctors
doctors
are...
are dentists.
Did I?
Yes.
Sorry.
Yeah.
Dentists are doctors, guys.
Yes. Yes. And
The
then
last one.
my question. What subject had you in a chokehold, and in what year did it hit you the hardest? So for me, the year and the course are in different years. So biochemistry was the hardest for me in second year. It was just a lot, but I think the hardest year was the third year, because in third year of dentistry, you start clinicals. So You're spending a lot more time in the clinic. You're treating patients. You're not really used to spending 4 or 5 hour blocks with patients and in the clinic. But you still need to study for midterms. You still need to read. You still need to do all these things. So the days feel longer. It's just so overwhelming coming from second year, which is kind of chill. So for me, I think I'll say third year for dentistry is the hardest, and my worst subject, biochemistry. Yeah, but I liked it in the end. But during the course of the year, I hated it. Yeah.
For me, it's surprisingly because a lot of students passed this one early on, but for some reason this was the hardest for me because this almost took me out. Microbiology. I was failing this class by 1 point every single time. I'm like, 1 point. You couldn't even close your eyes and just give me the extra point. Just, you know how you write an exam and you know, oh, I failed this exam. Or you write an exam and you're like, oh, I passed this exam. But the scariest thing is writing an exam and you're like,
I don't know.
I think that exam went well, but I could literally fail by 1 point. So that was a scary
And then
feeling.
failing by 1 point.
That was a trauma.
Yeah.
That was traumatic for you. But yeah, that was the hardest exam. Subject for me. And the hardest year for me was the third year because again, for me personally, it wasn't the medical aspect of it. I was dealing with a lot from outside. So having to deal, and I also feel like medical student, at least for me, we don't get time to process our emotions. You could be having the worst day, but you still have to show up to class. And
Who doesn't care?
No one cares.
Yeah.
You still have to show up to class because you cannot miss the class, or you're going to have to retake
There's
the
a
class.
midterm coming.
Exactly. Yeah, so for me, I was dealing with a lot from outside, and I still have to come to school and show up, and also adding on like so many exams. We're doing pharmacology, so it was just a lot for me. But yeah, I think it gets better. One thing Faye told me when I first came to med school, she was like, I was like, how is first year? How is second year? She's like, first year is going to be hard.
Yeah.
Second year, hard. But third year, it gets better.
Yeah.
It gets better. So yeah, it's true.
And
it
now
gets
you
better.
barely have school.
Yeah, now I'm chilling. Now I'm chilling.
Dentistry can't relate.
Oh.
It gets worse.
Yeah. For me, my worst subject was pharmacology. That could have gotten me kicked out of uni because I think there was like 6 midterms. And in those 6 midterms, I could not compile enough points to write the final exam. They said, nah, babe.
But I think that's really rude. Like how they do it, even for anatomy.
Yeah.
That you have to get
You have to have enough points over. Yeah.
It's like you're not ready.
They said, nah, you're not ready.
Take it at this
Take
time.
the summer, study
Yeah.
just pharmacology
Think
for
about
3 months.
yourself.
Exactly. So I didn't even get to write the final exam in June with the rest of the exams. And I mean, I was sad about it, but at the end of the day, I had won this exam that June, and it just made life a lot easier for me.
And more time to study for
Exactly,
pharmacology.
because then for 2 months, it was just pharmacology. I was waking up at 4 a.m. I'm just reading pharmacology. Why?
So you're a guru
Because I
now.
was stressed. No, I'm not. Hey, that's the thing.
Being us.
Guys, I just scraped. Nearly took me out. Yeah, that's it for me.
Anyway, so that brings us to the end of this phase. And the last phase, we're going to pretty much talk about what life after med school looks like. And these are the perfect people to ask that because they are in their last year of medicine and dentistry. So they already have an idea, at least I hope. We will see. They'll tell us. They already have an idea what the next step for them looks like. And that's also going to give you an idea what is really going through the mind of someone who's in the last years of medicine, or should go through the mind of someone finishing medicine or dentistry. So